I need you, guys and gals. So I wanted to be able to create something, a platform in which to be able to spread knowledge, health, and well-being to everyone around me. And in doing so, we've created this amazing community of patients and clients and friends and everyone wanting to learn more and more about what I've been doing. And now that the podcast has been taken off and people have been following me a little bit more on social media, there's a common question. Where did I learn all this stuff? And so over the past few years, I've been kind of cramming all this stuff together, and I've created this coaching platform where you have one-on-one access to me, and there are two different types of plans. There's a 6-month plan and a year-long plan for coaching, where I help you from how to start the business from the ground up, how to test properly. There's modules, there's handouts, there's basically all you got to do is say, hey, I'm in, pay your fee to get in. I will train you, I will coach you, I will get you up to snuff to make sure that you can start helping people in your community as well. And if you're like, is this for me? Anyone who has a beautiful heart inside, there is a vetting process for this, or an application process. I don't want terrible people joining this program because I don't want terrible people doing terrible things to people's health. You have to have a heart of gold here, really want to help others, and it doesn't matter what your background is. You could be a health coach, you could be a nutritionist or a dietitian, you could be a nurse practitioner, you could be a medical doctor, you could be a chiropractor. It doesn't matter. What I'm able to teach you is at a level that all the way up to like a surgeon can understand, all the way down to somebody who's never spoken a lick of health terms in their life. And then I can help to educate you to be able to formulate new custom protocols to be able to help patients in your community. So if that's something that you're interested in, please reach out to me so that we can start opening this up and enrolling new docs or new patients or new people into this program so that they can learn what I've been able to do so you can help me to help the world. Thank you in advance, and I look forward to meeting with you guys. Hey everybody, welcome back to another episode of the Doc Jock Show, and today is going to be one of these topics that, you know, I don't feel as though I should have to go into this much depth or pay this much attention to this. And the way that I'm saying this, I'm kind of hesitant to be too aggressive. I'm going to try to be as PC as possible in terms of verbally. And I'm just going to say, hey, listen, parents, this is a public service announcement for us. We need to do better. Parents need to do better. The more I get the opportunity to work with little ones, with kiddos in my practice, it doesn't matter where they are, whether they're in Canada, the US, across the world, different states. The level of care always misses the mark when it comes to medical doctors, and the urge would be, you know, when I work with parents, I am teaching you how to take care of your health, not just for you, but for that term that I talk about all the time when we're talking about generational health. What's happening is, from a very young age, kids are turned into consumers. And for this purpose, we're just going to be talking about medicine and you know, medical interventions. That's what this is. That's what this is going to be about. And so when kids are born, they're born with a leg back in a bucket, right? Like taking a step back in a bucket. We used to use that term when we played football. Like, you always want to make sure your first movement was forward. You didn't step backward into the bucket before you would go. And through children being born in hospital settings, they're already being born step back in the bucket. Children who are being vaccinated, stepping back into the bucket. The rate of childhood diseases is aggressively on the rise. They are renaming diseases like diabetes, right? Used to just be like adult diabetes, and now we have juvenile diabetes, kid diabetes. And if we were as good as the medical community says we are, these statistics would be on the way down. And we can't say this is because we have better diagnostic tools. Just do an objective assessment. Look at the children nowadays. They are heavier than they ever have been. Rate of obesity is up. Rate of medication consumption is up. But when we have these children born into this system, born into a sterile environment, more often than not, they're going to be born cesarean section or C-section. Then they're going to have earaches, ear infections, get antibiotics. Even though they're typically viral related, they're still going to get antibiotics for it. And then they start developing asthma, so they get an inhaler. Then they have indigestion, they have Tums or Prilosec. And as these kids get a little bit older, they go into puberty. Girls are having record rates of PCOS, endometriosis, PMS, PMDD from a very young age, and medicine is still continuing to treat the same exact way, maybe with a different medication because maybe the last one got banned, but that's the portal of entry for children. And what is really concerning is that was already bad enough. But when I talked with a patient with a 12-year-old daughter with cancer, Ewing sarcoma, and you know who you are if you know you're listening to this, hopefully you are, she informed me of how ridiculous healthcare is. Absolutely ridiculous. Now she just turned 12, got diagnosed Ewing sarcoma, and I asked the questions. Well, do you have any recent blood work, blood tests, etc., that I can take a look into to see, what may be off, whether livers, needing, if it's having liver enzymes being high, immune system markers being abnormal, can I see it? And she made the comment, they don't give it to us. They don't allow it. I'm paraphrasing a little bit. I'm like, what? She's like, yeah, because she's 12, we're not allowed, the adults are not allowed to have access to health records. I was like, what? And the kids are allowed to have access to their health records when they turn 14. But in between 12 to 14, it's just, to me, it's a giant social experiment without any legal documentation. How it's legal, I'm not quite sure. But it just got passed. And the reasoning behind it was this transitioning stuff, right? Almost swore again, but this transitioning trend that's taking place so that kids can seek puberty blockers and these other things without their parents' permission. So before, it was already medical doctors were screwing up, and now it's medical doctors are telling the kids to screw up without telling the parents. And then not only that, but the level of distrust that is growing between people and their doctors, medical doctors, oncologists, keeps increasing as well. There's a lot more concern because more parents are starting to get more educated on these topics of health and well-being. And so when we have, so she had that occur, and then she had, oh my gosh, she had another follow-up because her child was getting chemo. So they were going to take out and freeze her eggs because of the chemotherapy they were going to be doing to make sure that they preserved it and everything was going to be good. And then they didn't have the opportunity to do that before getting chemo treatment, and now her eggs are fried. And not only that, but the treatment doesn't have a very great success rate with her type of cancer. So she's already in the pipeline, took away the daughter's fertility, right, and a very low chance of success. Now, there is still, when this particular condition, when it metastasizes, there's still a good percentage that can still recover, 5-year success rate, et cetera. But when we stay plugged and chugged into that system, rate of success is not great. And so this isn't necessarily just about the cancer. This is the most recent thing that was shared with me. This is a wake-up call for us as human beings and for us as parents. If you don't have kids or you plan to have kids, you can still fall into the same boat here. We need to make sure as people, as humans, that we start tapping into our divinity. And what I mean by that is our divinity allows our body to be able to heal itself, right? So much of what we do is designed to tune out and tune into something else or someone else like me. When this occurs, we have this detachment, this disassociation with our feelings, thoughts, and emotions within our body. If we have an ache or a pain or a headache, we take something for it. If we're tired, we take something for it. If we can't sleep, we take something for it. It's how we have been conditioned. It is also how we continue to get sicker and sicker and sicker as a nation and as a species. When we still keep doing this reactive care crap, we're going to continue to go down the same pipeline until things get so bad that the only option is surgery, and then near death surgery, basically, or poison yourself back to health, quote unquote, back to health. Now, why chemotherapy and radiation is still a legal thing to do, I quite honestly, I don't know. There's so many other better things that you can do for that, especially because you can't poison yourself back to health. Now, if you've listened to me, I like to use extreme examples. This isn't too extreme, though. That was from Agent Orange, or mustard gas. I'm sorry, mustard gas is where chemotherapy came from. Obliterated everything. If you spill it anywhere, it's a biohazard, but they say it's safe to put in the body. Right? A medication. You have a headache. You don't have a headache because you don't have an aspirin. You don't have a headache because you don't have an Advil or an ibuprofen. You have a headache because something is wrong. Something is dysfunctional within the body. Every single time you do it, you're getting closer and closer to a more aggressive disease state. Okay? All of the literature shows it. Right? This is actually an interesting revelation I just received right now. We're so caught up in what to eat and how to eat that we're distracted. We're like, let's take this, let's eat this. This guy tells me I need to eat this way. This girl tells me I need to eat this way. I need to be vegan. I need to be carnivore. I need to do this. I need to do that, which is great. It's fine. It's dandy. It's awesome. Yeah, we need to get away from the standard American diet. Otherwise, we're going to develop the standard American disease, right? Rate of cancer is up. Cardiovascular disease is up. Weakened immune system's up. Asthma, allergies, diabetes, metabolic syndrome, you name it. New diseases coming out of nowhere are on the rise, because we're still choosing not to take personal responsibility for how we necessarily got there. So if we as parents, if we as humans, if we as aunts, uncles, grandparents, etc., if we don't have any kids, like, we can still be a role model for these children, for this upcoming generation. Because without good role models, they're going to be subject to go down and start idolizing false prophets, start idolizing horrible human beings, right? People that may be involved in sex trafficking or not really being a good example at all. I'm just thinking in my head, LeBron James. Like, I don't think any basketball player should aspire to be like LeBron James. I've seen a record number of flop videos with him just being a giant baby, but he's not a very good role model, right? So if we don't have good role models, if we are not a good role model in society, children are going to seek external role models, external validation for things that they want to do. And so they're going to follow down the line. Who is marketing to you? Who is trying to control you? I just watched a movie the other day, or a TV show, I forget what it was, where it was like, who's trying to control you the most? And it turns out it was the guys, like, oh my gosh, it was South Park. It was South Park last night. I don't usually watch it, but I did. And it was just the brainwashing and stuff that was taking place, and these influencers telling you to do certain things. And then it was like, who would be willing to pay this influencer so much money? And it ended up being the guy's stepmom, right? But who are these positive influences? Who's teaching kids how to eat? If it's not you as a parent, then it's going to be a teacher. Teacher's going to teach standard American diet. You're going to get standard American disease. When it comes to hormones, your PCP isn't going to teach you about hormones. Your endocrinologist doesn't know how to test hormones. It's been seen time and time and time again. You got to pull teeth. You got to pull like all your teeth out, all their teeth out, and just lose your mind in order to try to get them to test things properly or appropriately. And a lot of patients get upset about that. They're like, well, my insurance is willing to pay if I go and get this test done. I'm like, great, but insurance is only going to pay for what you're sick already with. So like, they're going to pay for what they can medicate. Is an easier way to say that. So if you have low T4, they're going to give you T4, Synthroid, right? They don't really care much else outside that. If you have antibodies, cool. They'll misdiagnose you hyperthyroid, and it's just this whole cluster, whatever, of nonsense. But they're not going to test you because they can't treat you naturally. They can't tell you about how the HPA axis is going to be involved in thyroid health, or how it's going to be involved in the endocrine system, right? But the system is failing. So we have the whole, upcoming here, right? And then women, girls hit maturity, puberty, and they develop their cycles. First thing they're going to get put on is going to be some form of birth control, usually followed by an antidepressant of some sort, all of which is going to make them tired. Probably could find their way to Adderall or Vyvanse or some other sort of, technically legalized cocaine form. They're going to go to college. They're going to drink their faces off, damage their livers, get rid of their B vitamins because it'll cause liver cirrhosis, and alcohol consumption will burn your B vitamins, which will slow down your detoxification pathways, slow down your energy pathways, and continue to make them sicker and sicker and sicker, right? Until what happens, right? You end up in a hospital and you have a gallbladder attack and they take your gallbladder out, or your appendix is about to burst, they take your appendix, or you develop PCOS and you're like, well, let's just take out your whole, reproductive system and you won't be able to have kids. But what's happening is not just this piece. It's not just like, hey, we need to beat them to the punch. We need to teach them how to eat healthy and be healthy. But then whenever it comes to these surgeries or taking things out, I keep meeting with more and more people when I'm like, oh, cool, you put on a statin. Did they put you on CoQ10? No, they never mentioned that. It's like, well, if you don't go on CoQ10, it's going to increase your risk for a heart attack or a stroke, the very thing that medication is supposed to help you with. They're like, oh my gosh. Or they take your gallbladder out. I'm like, well, I bet your hormones are pretty terrible. Your energy is bad. You probably have nerve pain. Your brain's probably not functioning 100%, right? How'd you know that? Or are you taking any bile salts or anything to help to emulsify fats in your diet? No. What the heck, right? Everything in our body is made of fat. Our cells have phospholipid. Lipid is fat bilayers. So the walls around the cells are made out of fat. If we cannot absorb it, then we're trying to rely on our liver, right, and our cholesterol to create these backbones for some of these things. And so our liver, our cholesterol is going to go and be elevated because it's going to be responsible for creating what we need within the body. Medicine will say, oh no, your cholesterol is elevated. Now we need to give you a statin and suppress that, right? But again, never talk about complementing in with a CoQ10. So it's just time and time and time again, the system is rigged against us until we develop this sickness and disease. So for a public service announcement for everyone listening is we need to take our health back. We're losing more and more control. We're getting put on more and more medications. We're losing more and more farmland, which means less organic food. We need to become self-sustainable. And I'm huge with like herbalism and herbal books and learn how to create your own legitimate botanical garden so that you can have your herbs that you need. And then I'll train you on it while we're going through protocols. Like I have a patient in Ohio. She's absolutely fantastic. She moved her family to Ohio. She wants to homeschool her kids, which is cool. And then she wants to create this botanical garden. So we were talking last time about like how to teach the kids and make the kids involved. So the kids then know like, hey, if we have something that's inflammatory, we can have some albizia, or I'm having trouble falling asleep, we have California poppy. But still at the same time, right, it's still an allopathic approach to a holistic problem, or a holistic approach in an allopathic way. You still want to find out what's causing that stress response. Why can't you sleep? Is it because you're stressed out all the time? Is it because you have lack of social relations? So no friends, no family, nobody around you. You're just isolated. Is it because you lost a dog like we have? Is it, what might it be that's interfering with the normal processes in the body? And symptoms are also a normal process. Disease is also a normal process, a normal adaptation within the body to let us know what's wrong. Just like if you have a plant, I got a plant right here. This pothos that I was growing, and it wasn't growing very well at all. And it was cold, and it was by the window, right? And so it was wilting, and I'm like, what in the heck is going on with this plant? It's supposed to be pretty resilient. I'm getting better with the green thumb. And I'm like, you know what? I think it's too cold. So I moved it, switched it to another window that got direct sunlight, moved it away from the window too, so the radiant cold from the window didn't cause the leaves to wilt. Watered it well, and now this thing looks like you could put it on your head like a wig. Like there's a ton of pothos growing out of that, right? So because it was wilting, it's not like, oh, this plant's bad, let's throw it out, let's just rip it out and put a new one in. I was like, well, what caused it to go dysfunctional to begin with? Because if I would have just tossed that plant out and put another one right where that one was, the same exact thing is going to happen, right? And so think about this from a cellular standpoint. The environment, the cells have like little antenna around the cells. So if I get rid of a cell, right, apoptosis, the cell dies, and I put another cell in the same environment, that same cell is going to express the same disease at a more increased rate because it's in a worse environment. That one dies, another one comes. Same thing. That one dies, another one comes. So you're just replacing a sick cell with a sicker cell, and you just keep doing that time and time again until the environment becomes so toxic that you develop cancer. And then the doctors will tell you, oh, it's bad luck. It's your culture, it's your age, it's your genetics, it's because you have 2 feet. It's because you have 2 eyes. It's because you have 10 fingers and 10 toes. Right? They don't have a reason behind it. They have an excuse. They have a forged permission slip, right? Your body's trying to tell you what's wrong. Somebody from the outside saying, no, that's not right. You just need this. You just need that. You just need this. You just need that. But it's getting worse. And the medical freedom is going down in all countries, in all states. Children are sicker than ever. And I am getting tired of seeing more and more people with more and more dysfunctional disease. I'm getting tired of people being overspent with their finances. They're broke as a joke because they've been spending all of this money, even though insurance pays for it. Insurance pays for you to die. On your path to death, insurance, pharmaceuticals, doctors make the most money. You get diagnosed with cancer, you become a cash asset to them. If they lose you and you go natural, they lose a crap load of money. They want to keep you in a system, right? So it's like don't worry, I'll pay for you. Just come with me. Just come with me. And then patients are like, well, I don't even care if I don't trust them. I know I don't really have to come out of pocket for this treatment. And then I'm over here like, we're going to have you do work. It's going to cost you some money, but it's going to get you the results you're looking for. Like, well, my insurance doesn't really cover it. It covers me to go die. And really that's the split. That's the difference between the two. Insurance will always pay for your death. Okay? It will never pay for your life. Right? Because insurance, they call it health insurance. It's not health insurance, it's death insurance. It's really death assurance because it's assuring you you're going to die and you're going to die at an accelerated rate. And if you don't believe me on that, then why is it that when we have disease in the body, the first thing that the doctor says isn't, hey, let's check your diet, let's check your lifestyle, let's check your sleep, let's check your water, let's check your protein intake, let's check your level of activity, let's do all these things, let's dive into what got you here. Instead, it's what can I give you based off of what insurance will allow me to give you. They're pigeonholed. So if you want to be healthy and well, you're going to have to step outside the insurance boundaries. Now, there are some insurances that are freaking amazing. They'll pay for all of our services, not just mine, but for others, right? But they're like your Christian Share, your Good Samaritan, or Solidarity. These other ones will pay for everything for you. But your standard medical insurance will absolutely not, because it's going to take people off the teat of insurance, the teat of pharmaceuticals, and actually make people healthy and well. And they'll lose you because you'll get results and feel better than you ever have. But we have to start stepping up as a species, as a society, as a human beings. We need to start protecting ourselves. We need to start listening to ourselves, listening to our bodies, tapping in and doing just body scans. How do I feel today? Do I feel like crap? Yeah? Okay. Is it because I slept bad last night? Maybe. Is it because I ate crappy food yesterday? Maybe. Is it because I'm stressed out of my mind? Also, maybe. Or dehydrated? Maybe. Did my wife kick me last night in her sleep? Maybe. The more information you're able to grab, the more you're able to scan your body and say, why does this feel this way? The more impenetrable you'll be as you move forward. Example, I messed up my Achilles tendon. It hurts. It hurt, right? And I could say, oh my gosh, why did this happen to me? Or, where can I take an Advil? Where can I get an ibuprofen from? Let's go to the store. Let's go get one. Or I could be completely different and say, let's figure out what causes and let's figure out how not to aggravate it and let's figure out how to fix it. I know how I did it, right? I was doing pretty intense calf raises quite often. And I don't do calf raises like a normal human. I do tibialis anterior flexion, and then I'll do gastroc and soleus flexion. I go both ways. I contract both ways as far as it could possibly go. And I squeeze the crap out of the tendon. And it hurt. I'm like, okay, well, I'm not going to do calf raises right now. I'm going to stretch the tight muscles. I'm going to get massages done. I'm going to reduce inflammation. I'm going to make sure my diet's keen. And I'm going to put things in that can help and rebuild the damaged area. Same thing should happen. If you have high blood pressure, figure out why. High cholesterol, figure out why. Migraines, figure out why. Lupus, figure out why. You're not going to find out why from your medical doctor. You're going to figure out what from your medical doctor. What is it? And what can I get for it? What is it? And what can I get for it? You'll never find the why going to your medical doctors. So start sticking up for yourselves and then start leading by example for your kids. If your kids are massively ill, look at yourself. Why? Why are my kids ill? What did I do to make them ill? Is it because I don't feed them good food? Is it because they never sleep? Is it because they eat garbage food all the time? Or I just keep going back to food because most parents do. Is it because I'm afraid to parent them and they're not going to be my best friends? What is it that's getting in the way of me helping my kids out? And most often it's because parents say, kids, I want you to eat healthy. And then parents are over there just scarfing down garbage food. And so there's this confusion that takes place between parent and child. And the child's smart and is like, well, why can't you tell me that's bad for me, but it's good for you? Why is that good for you, but not for me? And even if they believe that, then that would mean at some point in their life, they're going to switch into becoming you as the parent and be like, well, now because I am a parent, I can eat those things. Then they get sick and then they get disease and they pass that down to their children again, right? Generational health. So it starts with yourself. It starts with you as the parent. Set the example, lead by example, ask questions, do a body scan, teach your kids to do the same exact thing. And then you can nourish their bodies as they need it. It's really not that difficult. And there's always ebbs and flows. Like our kids still get sick every once in a while. They have some allergies and stuff going on right now too. We're still getting used to the pollen, or it's still considered pollen in Arizona. It doesn't play normal, but it's still pollen nonetheless. So it's an external stimulant from the external side going into the internal, and it exhibits symptoms, right? So it releases histamine because we're not used to it. We have to build up that tolerance to it. Okay, so doing these things over time will help to make you healthier and help make your kids healthier, your grandkids healthier, and then your whole family lineage will get better, and we'll be able to stop using the excuse of the family history, right? Because you'll wipe out a disease. And if the disease skips a generation, they're like, wait a second. And then it skips another generation, wait a second. And then it eventually gets wiped off the slate of the family history of cancer, family history of heart disease, whatever it may be. So use this information. It's a little bit more of a boring podcast, I'll be honest with you, but it's a call of action. It's a call to action for you as parents to start taking care of these kids. I can help you. And if you don't know how to do it, join our program. Start working with me. Start asking questions. Right? We do things where if you have a child under the age of under the age of puberty, basically, and it varies now, but if you have an underage child under the puberty age, we take care of them if one of the parents is under care as well. So it's like a 2-for-1 on that. Or if you're just like, I just have questions, right? We have that ability. We have these communication packages where you're able to communicate. If your kid gets sick, what can I give them? What can I do? How can I help them? How can I support them? Right? So we'll talk about how to work with symptoms, but also how to understand them to make sure that, hey, if this pops up, what caused it, so that when we know we do it again, then we can try to erase the outcome or fix the outcome because we fixed the underlying cause as to why they got it to begin with. So I love you all. Thank you for tuning in, and share this. Share this with any parent that you know. Share this with anyone you love so that they can know this information. Again, it's pretty basic, but realistically, it's just calling you to just be better, for us to be better. And I'm here to support you if you need it. We'll talk next time.